One of the most challenging things that we deal with on a daily basis for prostate cancer patients is sorting out all of their options.
We know it's pretty overwhelming to get that diagnosis, and I think we have a unique opportunity to be able to help them see the big picture and all of their options and spend time with them and give them the resources to make a good decision. Hello, how are you? I'm Dr. Bagsham.
The first step in your care is a consultation. You'll meet care team members who specialize in the use of radiation to treat cancer. They will work to understand what's important to you and answer all your questions. After consultation, you'll understand your diagnosis, treatment options, potential side effects, and next steps. Your doctor will consider the size and genetic analysis of the tumor, your PSA level, and your Gleason score, which stages the aggressiveness of the tumor. Your doctor will also want to hear about any prior illnesses and your overall health, your urinary and sexual functions, anything about your work or lifestyle that may be important, and any concerns you have. Then, together, you and your care team will decide on a treatment from the several radiation options that best suits you. This video is about treating prostate cancer with radiation therapy. It can be used to kill cancer in the prostate, or it may be used after the prostate has been removed with surgery to kill any remaining cancer cells. The goals of radiation therapy are to focus the treatment carefully to spare surrounding healthy tissues and to allow normal tissues to heal between treatments. Radiation destroys cancer cells by damaging their DNA with high-energy radiation, which disrupts the cancer cell's ability to divide and live. Stanford Healthcare uses two primary approaches to treat prostate cancer with radiation: external beam therapy, including CyberKnife, and brachytherapy. Your doctor will recommend the approach best suited to your diagnosis and treatment goals. The most common approach to radiation treatment is called external beam radiation therapy. It's given using machines called LINACs, short for linear accelerators, with various brand names such as TrueBeam or CyberKnife. These machines move around your body, but never touch you. You won't feel anything, and it doesn't make you radioactive. A special form of external beam radiation therapy uses very focused, intense radiation doses given in one or a few treatments for small tumors. This is called stereotactic ablative radiotherapy, or SABR. Because we have a broad range of technologies, each with its own special features, we can choose the best one to use for your particular case. Depending on the size or aggressiveness of your cancer, your doctor may recommend additional hormone therapy to starve the cancer of testosterone. This therapy is called androgen deprivation therapy. It's given through a cycle of injections. You and your doctor can discuss whether you may benefit from hormone therapy.
Mold for you today.
If you and your care team decide to proceed with radiation treatments, you'll come in for an appointment called a simulation. It's an important step in preparing for your actual treatments. Before your appointment, you'll be given special dietary instructions and advised to use an enema to ensure that your bowel is clear for a procedure. That procedure involves placement of gold markers or tiny radio transmitters near your prostate. They allow for very accurate alignment of your body for each treatment session. This implant procedure is like a biopsy, but is generally easier to tolerate. You'll be prescribed an antibiotic to guard against infection. After the markers are placed, you'll be asked to drink a couple of glasses of water to comfortably fill your bladder. That helps position the bladder away from the prostate during treatment. You'll undergo a CT scan and MRI to map your tumor area and aid the design of your treatment. A person trained in treatment planning, called a medical dosimetrist, will work with your doctor to build a 3D model of your tumor area to design a plan that targets the cancer and limits exposure to surrounding healthy tissues. A medical physicist will review those calculations to help confirm the treatment plan. Your doctor may order additional tests to support that decision-making. Your first day of treatment will begin 2 weeks after your simulation. You'll be treated once a day at the same time every day, Monday through Friday, for 2 to 9 weeks. The exact number of weeks will depend on what you and your doctor decide, based on factors such as urinary function. Most of the time scheduled for your appointment will be spent getting your body positioned correctly. The actual external beam treatment lasts just 2 to 3 minutes. You'll be in the treatment room for about 10 minutes and in the clinic for a total of about 30 minutes.
Here we go with treatment.
During your treatment, your radiation therapist will be able to see you and communicate with you through a speaker system. Another treatment approach that can be used alone or in combination with external beam therapy is called brachytherapy. It delivers high-dose radiation from inside your body out. Stanford uses a brachytherapy technique called high-dose rate, or HDR. With HDR, your care team will place a urinary catheter, and an anesthesiologist will give you medication to put you to sleep. Then your doctor will place tiny hollow needles inside your prostate to deliver radiation. Each HDR procedure lasts 3 hours, but because of the anesthesia, you should plan to be at the clinic for most of the day. Whether HDR is performed alone or in combination with external beam therapy, it's done twice. Those treatments will be 1 to 2 weeks apart. No matter what treatment you receive, your care team is available to you anytime you need, whether in person at the Radiation Oncology Clinic, by phone, or using the messaging service in MyHealth. The most common side effect associated with treatment is an increased need and urgency to urinate. You may also notice a slight burning sensation when you go. You may experience a similar frequency and urgency to have a bowel movement. As treatment progresses, you may feel more tired. It's important to stay physically active and to get plenty of rest. Most of these side effects are mild and tolerable. Some side effects may develop months to years later. Serious late side effects are uncommon. About 1 out of 3 men will experience varying degrees of sexual dysfunction due to a decrease in blood flow. Your doctor can prescribe medication to counteract that.
It's great to see patients and their families in follow-up because we can see how they've recovered from treatment, and then we can get a glimpse as to how they're doing in their lives after treatment and getting back to their regular day-to-day activities and their quality of life with their families, similar to what they were before treatment.
Welcome back.
Thank you.
We'll schedule follow-up appointments and make referrals to Stanford's Prostate Cancer Survivorship Program. It's designed to help you reestablish life as you enjoyed it before treatment and manage your wellness. Your team at Stanford Radiation Oncology is always here to support you.